Greetings and welcome to ME 181, week 4. This week we're going to talk about, going to start off with pre-authorization versus predetermination. What's the difference? Well, pre-authorization is defined as a required process which allows providers to determine coverage and secure an authorization approval from a payer for proposed treatment or service. Pre-authorization does not guarantee reimbursement of services. However, the lack of pre-authorization could result in non-reimbursement. The process of acquiring a pre-authorization could take from 5 to 30 days and is dependent on requirements set forth by the health plan. When pre-authorization is obtained from a payer, a pre-authorization number is issued. That number is required on the claim when it's submitted to avoid any unnecessary denials. In the event the claim is denied, based on a lack of medical necessity, providers should append the pre-authorization number when formulating an appeal letter. Predetermination is similar to pre-authorization as it allows services or treatment to be reviewed for medical necessity. In this process, benefit coverage is predetermined before services are rendered, and any limitation under a plan can be addressed before services are provided. A predetermination is really a courtesy where a pre-authorization is a requirement under a plan. When a payer recommends a predetermination for services, it's recommended to do it. Most predetermination results can take 30 to 45 days, and a complete history and physical of the patient should be included. If at any time, the service or services throughout a treatment course are denied, the predetermination can be submitted with the additional supporting documentation to help, the appeal denial. Help appeal the denial, I should say. At this time, Medicare doesn't require pre-authorization or predetermination for things like radiation and oncology services. The majority of pre-authorization requirements and predetermination requirements are from private payers. And just as a reminder, ensuring specific payer guidelines are applied is an important step in this whole process. You got to educate your staff, have proper communication and effective checks and balances in place, and effective process resulting in a maximum reimbursement can be achieved. I mean, if you've got everything the way it should be. Next, let's talk about the 4 parts of Medicare. You've got Part A, Part B, Part C, and Part D. So Medicare Part A is hospital coverage, and it's also called Original Medicare, and it's managed by Medicare and provides Medicare benefits and coverage for inpatient hospital care, inpatient stays in most of the skilled nursing facilities, hospice, and home health services. Part B is also called Original Medicare, and it's managed by Medicare and provides the benefits and coverage for doctor and clinical lab services, outpatient and preventative care, screenings, surgical fees and supplies, physical and occupational therapy. Medicare Part C is also called Medicare Advantage, and it's different. It's a different way of getting A and B coverage. Uh, Medicare Advantage plans combine Part A, hospital insurance, and Part B, medical insurance, together in one plan. They can also be combined with Part D, which is prescription drug coverage, creating Medicare Advantage prescription drug, or MAPD plan. Generally, these plans are offered as Medicare Advantage health maintenance organizations, Medicare Advantage preferred provider organizations, Medicare Advantage private fee for service, and Medicare Advantage special needs plans. Medicare Part D, as we said, is a drug plan, and it can be a standalone plan. It doesn't have to be joined with any other insurance, or it can be combined with Medicare Advantage plan. And as we said, then it's called Medicare Advantage prescription drug plan. What about TRICARE plans? We have various TRICARE plans. TRICARE plans are provided as a way to help pay for healthcare costs of active military members and its veterans. There are several different types of TRICARE plans that are currently available. I'm going to give you a look at some of the different plans. We have Reserve Select. This type of insurance coverage is designed to help members of the reserve. When you have this type of coverage, you'll be able to visit any TRICARE authorized provider. They could be in the network or out of the network. You can also visit military treatment facilities on a first-come, first-served basis. With this type of plan, you're going to have to pay monthly premiums in order to secure coverage, and there are different rates for individuals and families. And you'll have an annual deductible that you have to pay before full coverage kicks in. TRICARE for Life is another insurance plan that is provided for veterans. In the past, veterans were forced to utilize Medicare for health coverage once they reached the age of 65. However, with this insurance plan, we're still going to be able to take advantage of TRICARE even after you turn 65. This type of coverage is available to all veterans that are also eligible for Medicare, as well as their spouses. With this type of insurance, Medicare is going to pay medical costs first, and then it'll be followed by any secondary insurance plan, and then TRICARE for Life will kick in and pay. TRICARE Standard is a type of insurance coverage that is commonly used by military members and veterans. With this type of coverage, you're going to get the most flexible benefits of any plan that's available. Many people like this one because it allows them to see their own doctor. Instead of having to go to a specific facility, you can go to any medical provider that you want and pay a certain amount of money for it. This type of coverage is also known as pay-for-service coverage. With this type of insurance coverage, you're not going to have to pay any enrollment fees. You'll have to pay both a deductible and a copay. However, the fees that you have to pay for medical service are usually very reasonable, and you're not going to have to worry about a large medical bill. And then lastly, I'll talk about TRICARE Extra. This is another option that you can choose under the TRICARE umbrella. With this one, you're not going to have to pay any enrollment fee. You can also utilize TRICARE Standard. When purchasing prescriptions, you also will not have to pay any deductible as long as you use the appropriate pharmacies. With this type of insurance, you're not going to have to file your own insurance claims either. That's a big thing there. If they file for you, that makes it great. You're on week 4, getting good. The next week will be week 5, and with week 5, what we're going to be covering is Let me look at your objectives here. We're going to talk about obtaining height and weight, vital signs, mechanisms that cause variations in vital signs, list the sites for obtaining temperature and specific reasons for taking those measurements in that site, identifying the different pulse points, defining blood pressure in the meaning of systole and dystole, or systole and diastole. Some people pronounce it really funny. It's systolic and diastolic. Name and discuss the indications for equipment and instruments used by the health team in physical examinations. And we're also going to talk about understanding and being able to demonstrate the knowledge of the clinical responsibilities that you'll have. So I hope you have a good week, and I look forward to reading your posts, and I will post another video in week 5. Thank you very much.